Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving deep into a fascinating and increasingly popular field, animal-assisted interventions. If you're enjoying this, remember to like, share, and subscribe as proceeds from this channel go directly to providing vital veterinary care for animals in need. Even a small amount can transform an animal's life and ease an owner's burden. Research into human-animal interaction, including animal-assisted interventions, has documented various positive effects of interactions with animals. These include the reduction of stress reactions, depressive mood, anxiety, aggression, and pain. Additionally, these interactions are associated with the promotion of trust, calmness, motivation, and concentration. The effects of human-animal interactions, assessed through controlled experimental research or evaluations of animal-assisted intervention, have been documented and include neurobiological or physiological effects, as well as psychological and social effects. For instance, the presence of a dog has been shown to decrease cortisol levels in children and adults. It can also lower blood pressure and heart rate. Interactions with animals may even improve general health, potentially leading to fewer medical visits, less medication required, and better overall fitness. On the psychological front, there are indications that human-animal interaction has the potential to positively affect empathy, pain perception, and aggression, and to promote concentration and motivation. These interactions can also promote a positive mood and reduce depression, as well as reduce anxiety and promote a sense of calmness, particularly before and during stress-eliciting situations like medical examinations or treatments. Furthermore, human-animal interaction and animal-assisted intervention may increase social interaction. These documented benefits highlight why animal-assisted interventions are becoming more recognized as a form of complementary therapy. The field has greatly evolved, emerging from what was once seen as novel and unusual to generating significant enthusiasm from the public, and a growing number of interdisciplinary scientists and practitioners interested in studying and applying human-animal interaction.
That's quite a range of documented benefits. However, despite these observed positive effects, it's important to understand how and why they occur. Currently, there isn't one single, comprehensive theoretical framework that can fully explain the potential positive effects of animal-assisted interventions, particularly on people facing psychosocial and physical challenges. Since the effects of human-animal interactions are so varied, it's reasonable to assume that multiple processes are likely at work. Researchers and theorists have proposed several potential biological, psychological, and social processes that may underpin these effects. Theories attempting to explain why these positive interactions happen include the concept of biophilia, which suggests an innate human connection to nature and other living beings. Another theory is anthropomorphism, where humans attribute human characteristics and emotions to animals. A focus on the experiential system instead of the verbal-symbolic system is also considered, suggesting that the nonverbal nature of interactions with animals can be beneficial. Motivation is another proposed factor, as animals can provide a source of motivation for engaging in activities. The activation of the oxytocin system, often linked to bonding and social connection, is another potential biological process. Furthermore, theories related to attachment and caregiving are central to understanding the impact of human-animal interactions, including the idea that animals can provide social support for stress buffering. Lastly, the process of distraction is suggested, where the animal helps divert attention away from negative states or painful experiences. Some of these theories, specifically attachment, biophilia, and neurobiological processes like the activation of the oxytocin system, have been linked together in an integrative theory of human-animal interaction. This integrative view suggests that activating the oxytocin system, especially through physical contact, can lead to stress reduction in humans, potentially independent of their ability to regulate stress through human social support based on their own attachment representation.
Let's delve deeper into some of these theories, particularly attachment and caregiving. Against the backdrop of attachment and social support theories, several advantages of animal-assisted intervention and human-animal interaction have been discussed. One significant advantage is based on the observation that attachment representations formed with primary caregivers are usually not spontaneously transferred to animals. Instead, the majority of humans approach animals with an openness to securely relate, which includes touching and trusting. This unique dynamic provides an opportunity for establishing a secure attachment to the animal, especially within a guided interaction setting like animal-assisted intervention. Research indicates that companion animals can indeed serve as attachment figures for both children and adults, who may turn to them for social support when they are stressed. Relationships with companion animals frequently meet established attachment criteria, and due to parallels in social processes and brain structures, animals can be considered real social partners for humans. This capacity for animals to serve as attachment figures and provide social support could be particularly beneficial for individuals with insecure attachment styles, who might not be able to profit from human social support to the same extent. The opportunity for individuals to show caregiving behavior towards the animal is another potential advantage of animal-assisted intervention, compared to human-only approaches. This aligns with the idea that the caregiving system can be activated in these interactions, offering another pathway for positive effects. However, it's important to note that more research, utilizing careful measurement and appropriate controls, is needed to fully support the proposed processes based on attachment theory, including thorough observations and data on the caregiving system.
Building on the biological aspects, the activation of the oxytocin system is a key neurobiological process highlighted in the theories. Oxytocin is a hormone associated with social bonding and stress reduction. The integrative theory specifically links the activation of the oxytocin system, particularly through physical contact, to stress reduction in humans during human-animal interaction. This activation can contribute to the overall calming and positive effects observed. Research has explored the neurophysiological correlates of affiliative behavior between humans and dogs, with findings suggesting changes in neurochemicals associated with positive interactions. For example, dogs receiving positive human interaction have shown increases in beta-endorphin, prolactin, phenylethylamine, and dopamine levels, hormones associated with bonding, euphoria, pleasure, and happiness, indicating positive effects on the animals. While these studies often focus on the animal's response, the underlying principle of oxytocin system activation applies to the human side as well, contributing to feelings of attachment, trust, and reduced anxiety. This activation of the oxytocin system via easy-to-establish touch and physical contact is considered a potential special advantage of animal-assisted intervention. The neurobiological and physiological effects documented in research, such as decreased cortisol levels and lower blood pressure and heart rate, are consistent with the activation of a stress-reducing system like the oxytocin pathway. Measuring these physiological variables, such as salivary cortisol levels, blood pressure, and heart rate, is a way researchers attempt to capture the biological impact of human-animal interactions.
Another important proposed process, particularly relevant in settings where individuals might be experiencing discomfort or negative emotions, is distraction. The process of distraction through animals is primarily applicable in the context of animal-assisted intervention for the reduction of pain, anxiety, and negative mood. Animals provide a distraction from these negative states, a process likely also supported by human biophilia. Research in other areas has documented the effects of distraction through various means, such as music, cartoons, clowns, and engaging video games. The level of engagement provided by the distracting object, activity, or animal likely has a positive correlation with the buffering of stress and negative emotions. If animals can effectively distract and thereby reduce pain, depressive mood, or anxiety, this process would be highly relevant for settings such as hospitalization, medical procedures, or different crisis situations in the family. While what engages someone to an optimal extent is highly individual, and direct research specifically investigating the distraction effects of animals in animal-assisted intervention settings has been limited until recently, the potential for animals to serve as a powerful, engaging distraction remains a plausible mechanism for their positive impact. Beyond distraction, the broader theories like biophilia suggest an inherent positive response to animals, and anthropomorphism, the tendency to attribute human characteristics, can make interacting with animals feel more familiar and comforting. These underlying tendencies may contribute to the overall positive effects observed in animal-assisted interventions, working in concert with other proposed mechanisms like stress reduction and social support.
While the theoretical underpinnings are being explored, the research itself faces certain challenges. Although some reported effects, such as the increase of social interaction and physiological relaxation, have a relatively large database, for others, the evidence base consists of only a few studies or presents mixed findings. One significant challenge is the difficulty associated with sample size, research design, and providing appropriate controls. Results from studies in this field have been varied, partly due to these methodological complexities. Furthermore, the field might be subject to publication bias, which is the tendency not to publish non-significant results, potentially leading to an overestimation of the data supporting the positive effects of animals. There has also been concern about the misrepresentation and possible exaggeration of the impact of animal-assisted interventions on the humans served. Focusing too much on anecdotal outcomes rather than evidence-based research may have skewed perceptions. The media's often excessive and unscientific focus on the human-animal relationship can create an impression that a simple pet prescription can lead to miraculous results, which contributes to this exaggeration. Experts in the field emphasize that animal-assisted interventions should not be considered a panacea, but rather a valuable life opportunity that can make a difference. Scientists and practitioners need to be more tempered and realistic in their explanations of the efficacy of animal-assisted intervention, especially given that the scientific evidence is still not strong enough in all areas to support highly conclusive claims. Importantly, much of what is described in terms of potential effects and their likely processes depends heavily on the quality of the human-animal interaction. Researchers often seek ideal conditions, carefully selecting animals based on behavior and appearance to demonstrate potential effects. This selectivity highlights that the positive outcomes are not automatic but are influenced by the nature of the interaction itself. Despite these challenges, the field is progressing, with calls for more research based on specific theories, using careful measurement and appropriate controls, including observations and physiological data, to shed more light on possible mechanisms.
Beyond the human benefits and the theories explaining them, a critical aspect that has gained increasing recognition is the welfare of the animals involved. Simply put, animal-assisted intervention wouldn't exist without animals, making it absolutely critical to ensure their health and welfare in all aspects of the practice. Because the primary purpose of animal-assisted intervention is to use an animal to directly benefit a human, it is of the utmost importance that the animal is not negatively impacted. Historically, animals and human-animal relationships were often viewed from a utilitarian perspective. However, the question has thankfully shifted from what can we do to our animals, to what can we do for our animals. While the benefits to humans utilizing animal-assisted intervention are becoming clearer, the benefits and potential consequences for the animals are not always as transparent or easily measurable. As research works to build a stronger evidence base for the efficacy of animal-assisted intervention, there are ethical questions about whether the field is prepared to investigate the potential pressures placed on animals integrated into these interventions. A gap exists between what human clinicians explore with their clients and a thorough understanding of the risks the animals might face due to their participation. People and even some animal-assisted intervention practitioners may assume these interventions are harmless to the animals and that therapy animals naturally enjoy the sessions. However, animal-assisted intervention can pose a unique set of stresses and strains on animals, something the field has only recently begun to fully acknowledge. The most discrete threats to animal welfare in this context include the risk of zoonotic disease transmission from human to animal, and the mental and physical stress a therapy animal may endure because of the work. There have been reports in the literature suggesting that animal-assisted activities and animal-assisted therapy could potentially exploit animals and be detrimental to their well-being.
The ethical considerations regarding animal welfare lead to important discussions about the cost/benefit balance for the therapy animal. This balance addresses the implications of the animal-assisted intervention work on the animal's quality of life. To effectively protect the welfare of therapy animals, special considerations should be taken before the animal begins therapy work, consistently monitored during therapy work, and carefully planned for after therapy work is complete. While mixed results exist regarding stress-related welfare concerns for working therapy dogs, and more research is needed, the general practice of animal-assisted intervention doesn't appear overtly harmful to animals that are appropriately selected and handled responsibly. However, specific questions, such as the ideal duration and frequency of interventions, remain to be answered scientifically. It's challenging to provide blanket recommendations because no two animal-assisted interventions are identical, and each depends on the capacity of the specific animal in that particular scenario. The stress an animal-assisted intervention may place on an animal is influenced by numerous factors, including the handler, the human participant, the environment, and the interaction itself. Future research should investigate the effect these factors have on animal welfare. Until more studies inform practice standards, handlers must continuously monitor and assess their animal's behavior and remove them from work before it negatively impacts their welfare. Advancements in diagnostics and a better understanding of hormone changes are making it more feasible to study the effect of human interaction on the animal. Measuring physiological variables like heart rate variability, immune status through neutrophil to lymphocyte ratios, acute phase proteins, and salivary immunoglobulin A can provide information about the animal's stress state. The study of animal emotion, stress, and welfare is inherently challenging and requires the simultaneous assessment of multiple physiological and behavioral parameters. Future studies should incorporate a variety of measures to obtain a comprehensive assessment of the animal's well-being. An important ethical consideration is the notion that therapy animals should have the opportunity to retire from work. From an animal welfare standpoint, retirement is a critical and necessary phase of every therapy animal's life. The field should embrace the concept that an animal can be relieved of duties if its welfare is compromised during the work. However, this can present an ethical dilemma if the animal is ready to retire but the handler or participants are not. Understanding the best time to retire and how to do so gracefully is important. Ensuring the ethical treatment of animals in research is paramount. The Institutional Animal Care and Use Committee, or Animal Ethics Committee, plays a vital role in overseeing the ethical use of animals in research. This oversight has been underutilized in animal-assisted intervention research and is warranted to safeguard the use of animals in any study.
The evolving nature of the field and the increasing involvement of various disciplines highlight the need for greater clarity and refined standards. This has led to a push for the professionalization of animal-assisted intervention. There is a need for clearer definitions and requirements for practitioners to effectively implement these services. The International Association of Human-Animal Interaction Organizations has published definitions for animal-assisted activity and guidelines for the wellness of animals involved, aiming to clarify terminology and outline ethical practices for animal well-being. These guidelines are considered current and important for clarifying various aspects of animal-assisted intervention. Furthermore, the ability to replicate research methods is essential for growth in the field, but many animal-assisted intervention manuscripts lack the detailed information needed to successfully reproduce a protocol. Minimum details that should be included in every study are information about the animal participants, such as age, sex, species or breed, veterinary health status, training or certification. Details about the intervention itself, like frequency, duration of the intervention, and the length of the study, are also necessary. Critically, the incidence of any adverse events, including infectious disease or injuries, should always be reported. Rigorous review and detailed descriptions of the animals used in this type of research contribute to the quality and growth of the field. Those involved in animal-assisted intervention should be acutely aware of their therapy animals' welfare and incorporate practices that actively support animal well-being. It is our moral responsibility to heed the animals' silent communications and make decisions that prioritize their best interests, placing animal welfare at a comparable level to patient outcomes. Therapy animals can face challenges during their work, while preparing for sessions, or upon returning from them. Additionally, life situations like declining health or retirement can lead to reduced workloads or altered interactions, sometimes necessitating the cessation of work entirely. In making these decisions, the animals' wants and needs must be kept in mind. We must continuously monitor their welfare and develop better methods to measure fatigue and stress to achieve the best possible outcomes for both the animals and the humans involved. Globally instituted measures can help prevent pitfalls and safeguard the animals. The field has made significant progress, moving from asking primarily what an animal can do for a human to also asking what a human can do for their animal.
This push for professionalization, combined with the need for more rigorous research and attention to animal welfare, underscores the interconnectedness of research, practice, and public policy. Experts stress the importance of bridging research with practice to inform and drive changes in public policy. While there's growing public awareness of the value of coexisting with animals, bureaucrats may be more influenced by specific outcomes that demonstrate tangible benefits for humans, such as impacts on health, safety, and economics. This highlights the need for the research community to develop a platform for public policy that effectively links research findings with practical applications. Translational research efforts that bridge both research and practice are crucial for informing and driving public policy changes. Although more scientifically based evidence will always be necessary to convince skeptics, the broader societal movement for animal-assisted intervention suggests that the translation from research to practice is accelerating. The challenge lies in documenting needed best practice information for practitioners and supporting those practices with enlightened public policies, even as vital research continues. For instance, more attention is needed to understand best practice approaches, including determining the specific type of intervention that is most effective and the amount of time and intensity needed to achieve a change. These are often referred to as dosage questions. Ultimately, research can inform practice, and practice can highlight questions for research, creating a cycle where they complement each other to drive public policy change, especially when information is effectively shared with key stakeholders. It's crucial to maintain a realistic perspective. Animal-assisted interventions should not be seen as a panacea, but as a valuable opportunity to make a difference.
As the field matures, researchers are also exploring different comparison points to better understand the unique contributions of live animals. One area of interest is comparing the effects of real animals with those of robotic counterparts. A recent randomized controlled trial, for example, compared the effects of dog-assisted therapy with robot dog-assisted therapy in children with autism or Down syndrome. This study utilized active control groups, meaning the control group received an intervention with a robot dog, rather than receiving no treatment or just standard care, which is a methodology advocated by several authors to avoid potentially inflating the perceived effects of animal-assisted therapy. The robot dog in this study was designed to perform autonomous behavior, obey commands, show emotions, and follow children, although its capacity for true reciprocal interactions was limited. This type of comparison allows researchers to explore what aspects of the interaction are most influential. Is it simply the presence of a non-human entity, the novelty, or are there unique qualities of a live animal interaction that provide distinct benefits? The study investigated the impact on social skills, using parental questionnaires administered before, immediately after, and at follow-up. These studies are part of a broader discussion about using insights from human-animal relationships, particularly human-dog relationships, as a working framework for exploring human-robot attachment and designing social robots. Ethology, the study of animal behavior, suggests that behaviors observed in human-animal interactions can serve as prototypes for designing social robotic agents. Social robots are being designed to incorporate dimensions like anthropomorphism, emotion, and personality to trigger natural human responses. Studies have even used specific robot dogs, like the AIBO, in therapy settings to explore their potential.
The findings from the study comparing real dogs and robot dogs highlight the complexity of evaluating these interventions. On a group level, the results were nuanced and did not always show a clear advantage for the dog-assisted therapy group. However, when looking at individual results, the picture was often different, with some children showing clear benefits in areas like conversational attunement, social confidence, social cognition, and social motivation after dog-assisted therapy. The analysis of the Reliable Change Index, a measure of individual progress, generally showed more positive results for children in the dog-assisted therapy group across various social skill scales. In contrast, children receiving robot-assisted therapy tended to have lower Reliable Change Index scores. Interestingly, the study also suggested that children with the lowest intelligence quotient scores appeared to have the highest Reliable Change Index scores. However, the study acknowledges that children with autism and Down syndrome are incredibly diverse, differing on many characteristics beyond diagnosis and intelligence quotient. Therapists in the field tailor their interventions to the specific needs of each child, which makes it challenging to predict simply based on group averages who will benefit most. This raises the fundamental question of whether we can ever achieve a complete and clear picture of which intervention works best for which individual. As samples are divided into smaller groups based on specific characteristics, the groups being compared become smaller, making traditional analyses difficult. An alternative approach being explored is to examine the interaction dynamics between the child and the animal or robot, rather than focusing solely on their individual characteristics. This complexity approach, viewing psychopathology and intervention effects as patterns of self-organizing interactions, may offer a more individualized view of how animal-assisted therapy works. The study also pointed out limitations, such as the possibility that informal interactions with the real dog might differ from those with the robot dog, potentially influencing the results. There's also the potential for a novelty effect, where the robot dog might have been perceived as newer and more interesting, although using an active control aimed to mitigate this. The fact that different children in the dog-assisted group were accompanied by different dog and therapist teams is another important point to consider, given the likely importance of the dynamic within the child-therapist-dog triangle. Research comparing robot animals to real animals and using human-dog relationships as a template for human-robot interaction will continue to inform our understanding of the unique aspects of human-animal interaction. However, it's worth noting that studies looking at the general benefits of companion animal ownership have also yielded mixed results, with some reporting negative outcomes alongside the positive ones. This underscores the complexity of this entire field.
Thank you for listening to the Veterinary Medicine Digest. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.